Oral screening exam, starting on the outside. Your interactions with patients start when they're down the hall.
You're looking for asymmetry, tenderness, swelling.
Swelling, often the soft palate will be a little swollen and everything will be sort of pushed to the other side. That's a medical emergency.
Oh, yeah.
You know, for a number of reasons. A, because people can stop breathing.
The reason for starting an urban service track was complex. We obtained some relatively modest funding, and with those dollars we initiated an interprofessional track within the schools of medicine, nursing, pharmacy, dental medicine, and now social work. That was probably about 6 or 7 years ago, and the rest is history.
Started in 2007, this 2-year add-on program runs concurrently with the main curriculum and provides its scholars with enhanced learning opportunities.
I'm coming in, I'm complaining of, the fact that I can't swallow my pills because my stomach hurts. And what other information do you need to get from me?
Okay. Oh, onset. When did it start? P, provocation. What brought it on? What were you doing?
At the different learning retreats and through the different outreach activities, through all of the different curricular components, our urban service track scholars get introduced to the different vulnerable populations. These include children, the elderly, veterans, patients living with HIV, the homeless, immigrants and refugees, just to give a few examples.
The number of community-based field activities has also grown exponentially to accommodate the number of scholars and their interests.
Being in the Urban Service Track program has been tremendous in enhancing my knowledge of the primary care.
Learning retreats and community activities that are provided by the Urban Service Track exposes our nursing students earlier on to the issues that affect the urban and underserved community.
Pretty much wherever you go, whatever you're doing, breathing, living in urban service track, it's interdisciplinary and it's interprofessional.
These urban health scholars work as a team to learn to solve challenging issues of healthcare in urban areas.
If you have a patient that has diabetes, oral health impacts their diabetes. Diseases go, one impacts the other. You can't separate them out. Urban Service Track integrates interprofessional learning amongst the students in multiple ways. One of the first ways is with our learning retreats, where we have students from all the different schools, all representations, coming together, learning about vulnerable and underserved populations, and learning new clinical skills at those retreats as well, side by side.
And I'm particularly impressed by the health policy aspect of UST. Every single time we discuss a case together, it always comes up to health policy and how important that is. And I think in the trenches doing medicine every day, you can sometimes lose sight of the big picture.
There are a lot of older adults in Connecticut that don't know that Medicaid covers their dental. They just think they can't get care.
Hopefully the reformation of our dysfunctional healthcare system is going to push us as a healthcare system to better coordinate what we do and really to make it easier for all of us on the team to communicate, to access other services, and really to keep that patient really in the center of what we're doing.
And so they put me in the very environment I wanted to be in anyway. And so they provide the opportunities. They're the gateway. They give students the opportunities and to have these passions reinvigorated. And so I just really appreciate Urban Service Track for kind of taking the passion that I had inside of me and showing me how to actually act upon that passion in a productive way.